I think we are. This is a fun show. So what's on Uwabomp podcast, Jeff? Let me just get here. What are bioidentical hormones?
So bioidentical hormones means that the hormones are made to look exactly like human hormones. There have been a lot of hormones out there. So the things that we use for birth control, and previously when we used hormones for replacement, they were not bioidentical, meaning they did not look like your hormones that are roaming around in your body. And there's just two reasons for that. One is because of the pharmaceutical industry and the ability to patent and earn money. The other is because looking to do something that is not entirely a replacement. So things like birth control are mostly synthetic. So even though they're made to look like your own hormones in certain ways, they have added parts to it or changes to it that do not allow you to get the benefits of actually having bioidentical hormones. So most bioidentical hormones are made in the compounding pharmacy. And even though there are some that are made through pharmaceuticals, like what you would get at your regular pharmacies, like your big brand names like CVS, Walgreens, Walmart, the problem with those is quality and the ability for it to be micronized correctly. So depending on where they get it, there could be huge swings in bioavailability, which is absorption, whether or not it's working, whether or not it gets to the right place, and whether or not it was processed correctly. So that availability can make someone feel a little crazy because it's very, very broad as far as, will it work, will it not work?
So with bioidentical hormones versus synthetic, would you say that bioidentical are more customized to your own body versus synthetic?
Oh, yes. So for most of us practitioners, the reason why we use compounding pharmacies is because we can customize it for the patient. We are not all the same. Our doses for my patients vary wildly. The amount that we could give one person is very different from the amount that we could give another. And then at different ages, and depending on how far someone has been in menopause and their tolerance of hormones can change. And also, people's symptoms are wildly different. So using bioidenticals to a compounding pharmacy gives us the ability to make some strange doses, like 1.7. There is no 1.7 of anything out there in the hormone world, in the regular pharmacies, but that's something that we can do, compounded. And then we could also do things that are unconventional, say like do creams instead of orals, do things that melt under your tongue, or you could push against your cheek. And the delivery systems is customized to your lifestyle, to your ability to absorb, and to bring you the best effect.